In this video, I'm going to answer viewers' multiple sclerosis questions. Don't turn away, because it starts right now. Hey! Howdy! Thanks for learning about MS with me, Aaron Boster. I'm the founder of the Boster Center for Multiple Sclerosis, where we care for people impacted by MS from around the globe. We accept all major insurance carriers, and we're currently actively enrolling clinical trials. In today's video, I'm going to be answering some awesome questions posed by our viewers about multiple sclerosis. Let's jump in. Donajor8 writes,
Aaron, so initially, can someone with MS pass their neuro exam, or does the failure come later in the disease course?
That's a really great question. When we see someone with possible MS, we're going to do an evaluation. We're going to take a history where we're going to hear whether we have elements consistent with attacks or progression. And then we're going to do a neuro exam to see if we see evidence on exam to support those stories. Now, it's not required that the person has exam findings. And the exam findings can be subtle. And so you can, in fact, have multiple sclerosis with very minimal things on your exam if the story makes sense and the MRIs show lesions that are consistent. Each time we see the person, we're going to be doing some form of neuro testing, whether that be a traditional old school neuro exam or more enlightened functional testing. The point is we're monitoring them. And one of the things we're looking for is whether those change over time. If we see new neurological deficits picked up on exam or on testing, that's not okay. And that should clue us in that something's changing. Each time we see you, we're checking for it, but it doesn't mean it has to happen. The whole goal of treating you with a disease-modifying therapy, keeping your brain fit, participating in brain health, is to preserve the neurological reserve in an attempt at keeping that exam as normal as possible. DS asks,
Hi, Doc. If the MRI is normal, is there a need to do the CSF test?
And the short answer is probably not. There's 5 things that we look at when we're working someone up for possible MS. Their clinical history, what they tell us, what we see on exam, and number 3 are the MRIs. Now, if we have adequate information to make the diagnosis there, we probably don't need spinal fluid. If it's on the fence, the spinal fluid can be very helpful. By the way, the 5th thing is prove it's nothing else. But if you have a story in an exam, but the MRI is completely normal, with the modern criteria, you're not really going to be able to prove it's MS. And even if you had positive spinal fluid, it's not going to give you the diagnosis. If we did have someone that had a story concerning for possible MS, in plus or minus had exam findings, but the MRI was clean, even if we had positive spinal fluid, it wouldn't make a diagnosis. It would just lead me to want to repeat the MRIs more frequently. So in this instance, we might opt not to get the spinal fluid and instead just to follow serial MRIs. If you have MRIs without spinal fluid, you can make the diagnosis. But spinal fluid without positive MRIs, not so much. Solid question. Thank you for asking it. Dwayne asks,
Can Okrevis improve symptoms? I've been on Tecfidera for 6 years. I'm going to start Okrevis soon, hoping it helps with right-sided weakness and foot drop.
Dwayne, that is not the expectation of a disease-modifying therapy. In other words, I can't in good faith tell you for a limited time only for $9.99, if you sign up now and you take this medicine, you're going to grow wings and fly around the room. That's not going to happen. And we can't enter into a medicine with an expectation of confirmed disability improvement or improvements on your neuro exam. I will share, however, that some of the drugs are better at creating improvement than others. Now, Okrevis was not compared to Tecfidera. Okrevis in the clinical trials was compared to Rebif. And as compared to Rebif, people taking Okrevis in those trials increased the likelihood of confirmed improvement by 33% over Rebif, which is pretty cool. So to answer your question directly, I don't think it's fair to enter into Okrevis with that expectation that it's going to improve your side. If it does, I view that as a bonus. I will share, though, that there's another tool to make that side stronger, and that's aggressive physical therapy. And so maybe it's really a 1-2 punch of adding in Okrevis, a highly effective medicine to better control your disease, and committing to physical therapy so that we can get you where you want to get? Awesome question, Dwayne. Good luck with the Okrevis, and let us know how things go. Kevin writes in,
What do I do if your doctor doesn't want to do anything about the pain?
Kevin, pain is an invisible symptom, and it's actually a very common symptom in MS. And if you're having pain, you're doing the right thing by being your own advocate, telling the doc, hey, I'm hurting and I need some help. Now, if the doctor is not listening or not taking that symptom seriously, then you may just want to have a frank discussion. Say, hey, listen, I've been trying to share with you that I'm in really significant pain and I'm asking for help. You may even want to clarify, I'm not asking for narcotics, I'm not asking for pills, I just need something so that I don't hurt. And if that particular doctor doesn't feel a sense of comfort or a sense of confidence in treating that symptom, then it's fair to say, would you please refer me to an expert, to a pain doctor, or someone that might be in a better position to help me with this symptom because it's still really bothering me. You're allowed to advocate for yourself, and I would always encourage an open dialogue. You don't need to get upset with the doc, just ask for guidance and say, listen, if you can't help me with this, I respect that, but would you point to someone that can because the pain is really serious? Russ Keeney asks,
Are there antidepressants that are not SSRI medications?
The answer is yes. So SSRI stands for selective serotonin reuptake inhibitor. It is a class of antidepressants, a very effective class, with medicines like Prozac and Zoloft. There are other classes of antidepressants, like SNRIs, selective norepinephrine and serotonin reuptake inhibitors. And those are other antidepressants like Lexapro or Cymbalta. There are old school antidepressants like tricyclic antidepressants, things like Elavil and Pamelor. My point here is, yes, Russ, there's a bunch of different classes of antidepressants. And I want to point out that there's a type of doctor that is a wizard at this kind of pharmacology, a psychiatrist. Psychiatrists are amazing at manipulating antidepressants and combinations of antidepressants to help people with their mood. And if you're having trouble finding an antidepressant, that's a resource that you don't want to look away from, you want to look at. Seeing a psychiatrist to help figure out the exact right medicine or combination of medicine that works for you. And if SSRIs are off the table, they can sort that out. There are still other options. Gwen Joplin writes in,
Can you do a video just on the different types of medical Mary Jane in detail with names of the drugs, the indica versus sativa, the doses to start with? I'm in Arizona and just got my card. I really don't want to smoke unless necessary. I'm in horrible pain, but the bud tenders out here are clueless as what's good for me.
Well, Gwen, this is a great question. And actually, I think I'll plan an entire video on this topic, but I did want to speak to it a little bit right now. And really, you bring up 2 points. When you think about cannabinoids or cannabis plants, there's 2 big land races. There's indica, which hails from the Kush Mountains of Indica in Pakistan. And then there's sativa, which is found in tropical areas around the equator. And they're both cannabis. Generally speaking, indica plants tend to be a little bit more sedating, and sativa plants tend to be a little bit more uplifting. Now, the way that you consume cannabis is very relevant. And Gwen, I 100% agree with you. I do not recommend taking a carbon-based plant, lighting it on fire, and then breathing in the smoke. That is super pro-inflammatory, not just for your lungs, but for your whole body, including your brain. There are other ways to consume. And if we need something that works quickly, because sometimes pain happens fast, and so you can't take an edible and wait an hour. You need something that works fast, but we don't want you to smoke. So let me share 2 options that work really quickly. One is to vape. Vaping cannabis is where you heat it up below the level of burning, so below the level of combustion, and then you breathe in the vapors. And whereas that doesn't work as quickly as smoking a joint, it still works really, really fast, in the order of minutes. Another way, which is actually my preference, is something called tincture. A tincture is an old pharmacy term where there's a liquid that you use a dropper under your tongue. There are giant blood vessels under your tongue, and so it's quickly absorbed into your bloodstream, and so there's a very fast onset of action. So you can imagine, if you were successfully using medical marijuana to treat pain and you needed it to be fast, but you didn't want to suck on a vape pen and risk some inflammation to your lungs, you could use tincture. More to come on this topic. Great question, Gwen. Thank you for asking it.
What about passive smoking? I don't smoke, but in my bubble, there are people smoking in places indoors where people can still smoke. I'm afraid to go out lately because of fear of disease progression throughout passively smoking, but this stresses me out. Social isolation, even making me feel more disabled. What's your opinion?
I want to start off, Maria, by saying this is a very, very real world situation. In the real world, you have competing things going on, and avoiding all of your friends makes you feel socially isolated. But participating in the activity of sitting around a table and being exposed to smoking might not be the best option. So what do? Well, one thing you might want to do is you may want to talk to your inner circle, your bubble, and say, hey, listen, can we pick an activity that doesn't involve me being exposed to secondhand smoke? Now, you may find that some of them say no. You may find that some of them say yes. Another option is maybe you can choose an activity that's literally outside, where you can socially distance 6 to 8 feet. And if there's a smoker 8 feet away from you and you're wearing a mask, I think that you've minimized your risk quite a bit. An alternative option is to invite people to an activity where smoking isn't allowed in that space. You're allowed to be your own advocate. You're allowed to say, hey, listen, me being exposed to smoke is not awesome, and so help me come up with an option where we can spend time together, but that's not the activity. If you'd like to hear more Q&A with me, click the button that's on the screen right now. My name's Aaron Boster, and I want to thank you for learning about MS with me. Until my next video or my next live stream, or the next time I see you at the Boster Center for MS, be safe and take care.